Welcome back to Mid-Morning. Congenital Heart Defect Awareness Week is underway. For American Heart Month, the American Heart Association wants to make sure every parent knows CPR. Here to tell us more are Andrea Ooten and Callie Rzasa. Thanks for coming in and talking to us today.
And thanks so much for having us.
So first off, CHD, if people don't know about that, kind of explain what that is.
So congenital heart defects are defects that babies can be born with, and unfortunately about 40,000 babies each year are born with the CHD, which is about 1 in 100 births. So many children are impacted by this. It is the most common birth defect. So we want to build awareness, make sure young parents and families know to consult their physicians about this and the possibilities, but also to build awareness around research that we're doing at the American Heart Association that can impact and help extend lives for people impacted.
Is this something that is diagnosed right away? Can it be diagnosed later? How does that normally work?
Yeah, I think, Callie, why don't you?
Yeah, most of congenital heart disease is diagnosed prenatally, which is why having excellent prenatal care and a close relationship with your obstetrician is so important. But unfortunately, still 30% of patients with serious congenital heart disease are not diagnosed until after they're born, and sometimes even after they go home. So physiology changes a lot in that first couple weeks of life. So that's important for you to bring up any questions with your pediatrician so we can get help and diagnose the baby if we need to.
You talk about research and funding. How important is that as far as just keeping that money going to help find hopefully a cure, treatment, just all of that?
Yeah, certainly, funding helps us to fund a lot of different researchers across the country, and we've worked together with several different organizations to fund CHD research specifically. We know that treatment options and a lot of the different ways that we're able to diagnose now come from those research dollars and grants that we've given over the years. So.
With only 1 in 100 births having congenital heart disease, it sounds like a big number to us, but actually in medicine, that's a very small number. So we very much rely on having those organizations to share knowledge across physicians, across institutions, so that we can find the best treatment for these kids.
That makes sense. And one thing you're talking about, so important for parents to know, CPR. Why is that?
Well, you never know when you need to be a heart hero. And so it's best to be prepared just in case. And we are coming into Valentine's Day, and we have a lot of places where we can learn about how to do CPR. I would say take a Valentine's Day date with your loved one and go learn so you can take care of your family members.
And you all have actually brought a model child here to kind of demonstrate here what you're talking about.
We did. So this is one of our infant models for CPR. And so for infants, it's slightly different for adults. If you unfortunately find yourself where you need to do CPR in an infant, first thing you do is call for help. Make sure someone calls 911. Then if you have somebody with you to join you, that's great. But if you're by yourself, just take a look at the infant, see if they're awake. And to do CPR, you're going to place your thumbs, either both of them like this, across the midline of the chest. Press hard and fast. 1, 2, 3, 4. And you're going to do 30 compressions in a row and then give 2 rescue breaths. And if you have someone helping you, you can share the rescue breaths and the compressions.
And one of the reasons it's so important, I guess, to practice is so that you already know this. You're trying to figure this out in the moment of an emergency, not the time to be doing that.
In emergency, you need muscle memory. So the more that you can automate yourself so that if you need to act, you can without thinking about what your muscles actually have to do.
All right, more information on your website along with classes and other things like that. Thank you all so much for coming in.
Thank you.
Got the information up there, heart.org/Kentucky. Keep it here on Mid-Morning.